Did you know that doctors can often spot serious health issues in their elderly patients just by noticing certain hygiene habits? These seemingly innocent oversights could actually be silent warning signs of dangerous conditions developing beneath the surface. What's truly alarming is that most seniors don't realize they're making these critical mistakes every single day. In the next few minutes, I'll reveal 7 personal hygiene mistakes that doctors immediately notice, and more importantly, how fixing them could literally save your life or the life of someone you love. This isn't information you'll find in school books, rarely gets brought up in a doctor's office, and almost never appears in mainstream health magazines. Yet it could be the difference between enjoying your golden years in good health or suffering from preventable conditions that steal your independence and dignity. Let me introduce you to Harold, a 75-year-old retired engineer who believed his personal care routine was just fine. Harold was active in his community, played golf twice a week, and never missed his grandkids' baseball games. But during what he thought was a routine checkup, his doctor spotted 3 critical hygiene mistakes, clues that Harold had been developing a serious health condition for months, completely unaware. "I had no idea," Harold later told me. "I thought I was taking good care of myself. If my doctor hadn't noticed those small things, I might not be here today to tell you this." Today, I'll share exactly what those mistakes were so you can avoid going through what Harold did. And more importantly, I'll tell you what to do instead. These are simple changes that could add years to your life starting today. Mistake number 1, neglecting oral hygiene. When was the last time you really looked at your toothbrush? Is it frayed? Worn out? Are you brushing thoroughly twice a day? But here's the more important question. Did you know that poor oral hygiene is linked to heart disease, stroke, and even dementia? According to geriatric specialists at Harvard Medical School, bacteria from untreated gum disease can enter your bloodstream, leading to life-threatening heart conditions. Their research shows that seniors with poor dental hygiene are 3 times more likely to develop cardiovascular problems than those with proper dental care. Let me tell you about Sylvia, a 68-year-old retired teacher from Oregon. She ignored her bleeding gums for months, assuming it was just part of getting older. "I just figured it was normal," she said. But during a routine checkup, her cardiologist discovered dangerous inflammation in her heart valves traced directly to bacteria from her gums. He told her that had she waited a few more months, the damage could have been irreversible. Here's what to do now. Examine your toothbrush. If it's more than 3 months old or shows wear, replace it today. Ideally, switch to an electric toothbrush, which removes 62% more plaque than manual ones, according to the University of Pennsylvania Dental School. Brush twice a day for 2 full minutes. Set a timer if needed. Floss every night, no exceptions. And don't skip dental checkups even if you wear dentures. Bleeding gums? Swollen areas? These aren't normal. They're warning signs your body is talking to you. Don't ignore it. Mistake number 2, infrequent bathing and skincare. How often do you bathe honestly? Many seniors bathe less frequently as they age, often to avoid dry skin. But your skin is your largest organ, and its condition can reveal serious health issues before other symptoms appear. Dermatologists at the Mayo Clinic warn that reduced bathing in older adults can hide early signs of diabetes, liver problems, and cardiac issues. Their studies show that nearly 40% of undiagnosed medical conditions in seniors could have been caught earlier through proper skin observation. Take Clarence, a 77-year-old retired postal worker from Michigan. In the winter, he only bathed once a week to avoid drying out his skin. "I didn't want to dry out my skin," he explained. But during a visit for an unrelated issue, his doctor noticed unusual skin discoloration. Tests later revealed early-stage kidney disease. The infrequent bathing had hidden a symptom that could have been spotted weeks earlier. Here's what you can do. Aim to bathe at least 3 times per week, even if you're not very active. Use gentle, fragrance-free soaps to avoid drying out your skin. Moisturize right after bathing while your skin is still damp to lock in hydration. And regularly check your skin for changes. Dry patches, discoloration, persistent itching. These are not just skin issues, they could be signs of something deeper. Mistake number 3, ignoring nail care. Take a moment. Look at your fingernails and toenails. Are they neatly trimmed, clean, free of yellowing or odd textures? Nail health is often a first clue to what's going on inside your body. The American Academy of Dermatology notes that nail changes can signal over 20 different systemic illnesses, from anemia to thyroid issues to heart disease. In patients over 65, nail abnormalities led to diagnosis of internal conditions in nearly 30% of cases. Meet Beatrice, 82. She noticed her toenails thickening and yellowing but assumed it was just aging. "I just stopped wearing sandals," she said. But when she finally saw a podiatrist for foot pain, he diagnosed a long-standing fungal infection, a sign of a severely weakened immune system. Further testing revealed a serious condition requiring immediate treatment. What you should do: trim nails regularly, straight across with slightly rounded edges. Keep them clean and dry. Wear breathable shoes and change socks daily. Never ignore nail discoloration, thickening, or brittleness. These are not just cosmetic issues, they're vital indicators of your internal health. Mistake number 4, ignoring incontinence and hiding it. This one might surprise you, not because it's rare, but because of how common it is, and how many people keep it a secret. More than half of seniors silently cope with some form of incontinence. But the real danger isn't the condition itself, it's how many people don't talk about it or seek treatment. According to urologists at Johns Hopkins Medicine, untreated incontinence can lead to painful skin infections, dangerous falls, social withdrawal, and even hide serious issues like prostate or bladder cancer. Their research shows that seniors who address the issue head-on have 60% fewer complications than those who try to manage it in silence. Take Douglas, a 73-year-old retired accountant from Arizona. He was too embarrassed to mention his occasional leakage, so he used paper towels and changed clothes often, thinking he was managing it. But when sores developed and he finally saw a doctor, they uncovered an advanced prostate condition, one that could have been treated earlier with far better results. "My pride nearly cost me my life," Douglas admitted. "I wish I had spoken up sooner." So, what should you do if you're experiencing any form of incontinence? Talk to your doctor. This is a daily conversation for them. Don't be shy. Use the right products. Choose high-quality absorbent products made for incontinence, not DIY solutions like tissues or towels. Change promptly and clean thoroughly to prevent skin issues. Understand this key fact: incontinence isn't just aging. It's a signal that something might be wrong, and it deserves medical attention. Are you struggling with incontinence symptoms? Don't wait. Act now. If you find yourself planning outings around bathroom availability, constantly adjusting makeshift protection, or even experiencing occasional leakage, it's time to stop ignoring the signs. Your body is giving you important signals, and delaying action can have serious consequences. Incontinence isn't something you should just deal with or try to hide. It's something that deserves attention. We all know how easy it is to brush off certain issues when they feel embarrassing or uncomfortable, but when it comes to your health, you can't afford to do that. Treating incontinence isn't just about improving comfort, it's about preventing long-term complications that could affect your quality of life and even your survival. By consulting a doctor, using the proper products, and sticking to a cleansing routine, you're not just managing symptoms, you're protecting yourself. In fact, your health, your independence, and your life may depend on it. If you're waiting for a better time to address these symptoms, don't. The longer you wait, the more challenging and risky the situation can become. Seek help today. Your future self will thank you. Your hearing is precious. Protect it with proper care. Mistake number 6, neglecting foot hygiene. When was the last time you truly examined your feet? Not just a quick glance, but a thorough inspection, checking between the toes, the soles, the heels. Your feet are often the first place doctors look to spot signs of circulatory or nervous system problems, especially in elderly patients. According to podiatrists specializing in geriatric care at the American Podiatric Medical Association, poor foot hygiene can be an early warning sign of conditions like diabetes, neuropathy, and vascular disease. Studies show that, for patients over 65, regular foot care and proper inspections can prevent up to 85% of diabetes-related amputations. Yes, 85%. That's a staggering number, and it's preventable with the right care. Consider Raymond, a 76-year-old retired factory worker from Illinois. He ignored the dryness and small cuts on his feet, thinking they were just natural signs of aging. "My feet had been looking rough for years," he said. But when his doctor noticed them during a routine exam, he immediately ordered diabetes testing, discovering the disease in its early stages, when lifestyle changes could still make a big difference. "If my doctor hadn't checked my feet, I might have gone years without knowing I had diabetes," Raymond admitted. "By then, the damage would have been severe." So what should you start doing today? Wash and dry your feet thoroughly every day, especially between the toes where fungus tends to grow. Inspect regularly for cuts, sores, or changes in color or temperature. Early detection can make all the difference. Wear clean, dry socks made from natural fibers or moisture-wicking materials. Apply moisturizer to dry areas, but avoid the space between your toes. Never ignore pain, numbness, or wounds that don't heal. These could be signs of serious underlying health issues. If your feet are dry and cracked, have cuts that aren't healing, or show any unusual discoloration or loss of sensation, don't dismiss it as cosmetic. These could be early warning signs of serious conditions that require immediate attention. Mistake number 7, medication-related hygiene issues. Are you currently on multiple medications? Have you noticed changes in your body odor, sweating patterns, or mouth dryness since starting them? The medications keeping you healthy could also be causing hygiene problems that signal dangerous side effects. Pharmacologists at the American Geriatric Society have documented how certain commonly prescribed medications can cause symptoms like dry mouth, excessive sweating, or changes in body odor. Their research shows that nearly 40% of adverse drug reactions in seniors present as changes in personal hygiene, often before more severe symptoms appear. Take Barbara, a 67-year-old retired nurse from Florida. Her family dismissed her unusual body odor as poor hygiene, but her geriatrician quickly recognized it as a sign of medication toxicity that was slowly damaging her liver. "I was showering regularly and using deodorant," Barbara explained. "I had no idea the smell was coming from inside my body, not from lack of cleanliness." What can you do to protect yourself? Track hygiene changes after starting new medications. Keep a simple journal of any differences in body odor, sweating, mouth dryness, or skin changes. Stay hydrated, unless your doctor advises otherwise. Report unusual changes like excessive sweating or odor changes to your doctor immediately, as these could signal dangerous drug interactions. Never adjust your medication dosage without consulting your doctor, even if you think it's causing hygiene issues. Have you noticed changes like unusual body odor, excessive sweating, or extreme mouth dryness despite regular hygiene habits? Don't just chalk it up to aging. These changes could be warning signs of potentially serious medication side effects that require immediate attention. Prevent serious health problems and protect your independence. Now that you know about the 7 critical hygiene mistakes that doctors often notice in their elderly patients, you have the knowledge to take action. By addressing these issues today, you're not just avoiding discomfort, you're actively protecting your health, dignity, and even your independence. Remember, hygiene isn't just about looking good or being socially acceptable. It's essential for maintaining your health as you age, and small changes can have a major impact on your life. In fact, these simple adjustments might even save your life. If you found this information valuable, hit the like button right now. Has your doctor ever pointed out any of these hygiene concerns during your visits? Share your experiences in the comments below. Don't forget to subscribe and tap the notification bell for more life-saving health tips like this one. And please share this video with your loved ones, especially those over 60. This information could literally save their lives.